This morning in today's checklist, the latest tools, tests, and screenings to keep tabs on your health. As more people are getting proactive with their health decisions, you may want to ask your doctor if some of these are right for you. So here to tell us more is NBC News medical contributor, Dr. Vin Gupta. Dr. Gupta, good morning. Nice to have you here.
Good morning.
So I have a lot of heart disease that runs in my family. So, I'm fascinated by these first two tests because I haven't heard of either one. So we know of good cholesterol and bad cholesterol, but there's another thing we can test for.
There is, and I think this is going to get talked about a lot more. These new tests that, frankly, we're realizing are better than, say, cholesterol, the typical LDL bad cholesterol test that we've been talking about for decades. There's now a new, very hopeful future with these new tests. So, consider it especially, you and I were talking about this earlier, if you have a family history of heart disease, you've heard mom or dad, grandma, grandpa have had, say, a heart attack, think about this new lipoprotein A, it's called, this sort of word jarble, or apolipoprotein B. Lots of words there, but talk to your doctor about those tests.
Test?
It's a blood test,
okay.
and frankly, they're better, more precisely linked to maybe a risk factor for heart disease than typical bad cholesterol. So that's one thing to think about. If you're on high cholesterol, despite being on medications, you still have high levels, definitely go get these tests.
Okay.
Other risk factors, again, family history, things to keep in mind, but this is really something you want to ask about.
And it seems easy enough.
Easy enough.
Hello.
Hey, Jill.
All right, so you also say you should get ask about a coronary calcium scan.
That's right.
I wouldn't even think to ask, know to ask.
Most people don't. And I'll say, Jill, this is something that, frankly, a lot of doctors are just learning about because we're just building up evidence that this is perhaps something everybody 40 years of age, Jill, and on up, should be at least talking about. If you have a family history, like we were talking with Dylan, if you know that heart disease runs in family and you're, say, age 40 and up, have a conversation about a coronary calcium CT scan. And what is it? Basically, you lie on a bed. You get a typical CT scan. For those out there that may have had a CT scan before, it's no different. It takes about 10 minutes, totally painless. And it's basically just an image of the arteries around your heart. And it helps us understand how much plaque there is. It actually gives us a visualization and a score. And gives us a far better sense of your risk for maybe something potentially bad happening in the future that we would need to intervene on now.
Right, and I guess they always say that you may find something else. So it's you have to.
It's always good to keep up.
Dr. Gupta, let's talk cancer for a moment here because I think most folks realize there's an age at which you should get a mammogram. There's an age at which you should get a colonoscopy.
Yep.
But there's some blood tests now that could be very helpful in the fight against cancer.
There are. Craig, you might have heard of Shield. This was the first FDA-approved blood test for colorectal cancer screening, approved in 2024. And it's a big deal because a lot of people don't like to get colonoscopies in the prep. It's incredibly inconvenient. And so what does it say? Basically, it's these tests, whether they're Gallery, Triac, Shield, the name doesn't matter. Essentially what they're looking for is DNA being shed from a cancer in your blood. So it's a blood test.
How accurate are they?
So the big con here is that these aren't great for early detection. Okay. And so advanced cases tend to be better, greater accuracy. Earlier stages, they can be good, but not fantastic. So that's why, based on your family history, based on genetic history, colonoscopies might still be the right choice for you instead of the Shield test, but it's a good pre-screen. It's a more accessible option. I'll say in many cases, though, the Gallery test, again, tests for 50 different types of cancers, but it's $949. Yeah. Insurance often doesn't cover it, so this can be inaccessible for a lot of folks.
I'm going to ask a question that may be a bit controversial. If you buy one of these tests and it comes back and it discovers that you got some sort of cancer, but it's slow growing.
Yep.
Is that something that we should be concerned about?
It's important to know.
Okay.
Because then I think if it comes back positive, the question is, what do we do with it?
Okay.
And maybe we have to go in the case that maybe we get a colonoscopy, maybe we get a full body scan. That's the complexity. We just don't totally know, but it's good to know something might be brewing so we can keep an eye on it.
Let me ask you another question as we get ready to talk about this flu stuff.
Yep.
If should there be any worry that if you do find out you've been diagnosed or flagged for one of these cancers, that your insurance company might get wind of it and you might be denied coverage for having a pre-existing condition?
Well, that would, technically that's against the law.
Okay.
And so that should not happen. But I understand why people would be worried about it and data privacy. This should all be data protected. But Craig, I'm glad you're asking that question.
All right, let's talk about flu. By the way, feels like we're just getting out of flu season.
That's right.
Now we're talking about next flu season.
Well, you guys were just talking about holiday shopping. So we're trying to make this, get people ready for the wintertime.
Fair.
Yeah.
We've got some new tools in the toolkit.
Yep. That's right. So, for those 2 to 49 years of age, Craig, this is pretty cool. If you don't like needles, if you don't want to schedule an appointment at the pharmacy because it's just inconvenient, now your doc can prescribe you a flu vaccine that you actually just spray into your nose.
Just as effective.
It's just as effective. Actually, the data is pretty darn good. It's for 2 to 49 years of age. You still need a prescription.
Wow.
You can self-administer it at home. Painless, super easy. Next flu season, talk about it. Again, at-home use by prescription. And you know what, Craig, this is great. You and I talked almost every day during COVID.
Literally, yes.
Quite literally. COVID, flu, RSV tests. Now we have a better way to understand if those sniffles or those full body aches, if the test for COVID isn't positive, it might be flu, might be RSV. We have that all 3-in-1 test that's going to be coming online too, which is good.
Over the counter?
Over the counter.
Okay.
Wow.
Dr. Gupta, thank you.
So good. You have to advocate for yourself.
Amen to that.
Thank you so much.
Thank you.
All right, well, coming